And of course, the WHO, the World Health Organization, is vital to international efforts in improving global health. And it believes that the new Sanitation and Hygiene Fund will be a significant catalyst in achieving this.
Let me get right to the point. Over 2.1 billion people lack even basic sanitation facilities. Twice that number lack safe sanitation services that properly collect and treat waste. This means that more than 4 billion people, about half of the world's population, are at risk of diseases like cholera, intestinal worms, and malnutrition. In fact, poor sanitation impacts the safe delivery of healthcare across the board, including for antimicrobial resistance, one of our biggest global health threats. Let me be clear. These disastrous health effects are preventable. This is a problem that can be solved. While the challenge is significant, the road to improving sanitation is well trod. The fundamental science has been known for decades, and the benefits are clear. Countries that have invested in sanitation for all as a public good have transformed public health, the environment, and their economies. What's more, data shows investment in WASH is cost-effective. The economic benefits of sanitation are about 5 times the cost. But all too often, what is missing is leadership. The world is alarmingly off track to deliver on our commitments to Sustainable Development Goal 6 for sanitation. Estimates project that the annual cost to achieve universal sanitation by 2030 would be $105 billion. Current investment from governments is less than 10% of what is needed. Yes, achieving universal access to WASH may seem expensive, but the cost of inaction is far greater. Lack of sanitation results in greater recurrent and preventable healthcare costs, lost income and educational opportunities, loss of productivity, and environmental pollution. What is needed is bold action, and there is no time to waste. WHO welcomes the new Sanitation and Hygiene Fund as an important mechanism to increase and catalyze national investment. The State of Sanitation report by WHO and UNICEF sets out a path for investment in governance, financing, capacity development, data, and innovation. WHO is committed to working in solidarity with governments under the SDG 6 Global Acceleration Framework and with other UN agencies and partners like the Sanitation and Hygiene Fund to urgently accelerate action on sanitation. I am confident that with strong public health investment and leadership, together we can make sanitation for all a reality. WHO is calling on all partners and member states to significantly increase investment in sanitation. The benefits across the health sector, economy, and society are well documented. WHO is calling on the health sector to play its part, especially by ensuring sanitation in healthcare facilities and at the community level by using health data and expertise to ensure sanitation investments are targeted and implemented correctly. This is critical because ultimately it will reduce the cost and burden on the health sector. But let us remember, sanitation, along with clean water and hygiene, are not a one-time investment. We must not repeat the mistakes of the past. Like health systems, doing it right requires sustained funding and careful management. So make no mistake, sanitation is an ongoing commitment. It is a commitment to a better world for all. And most importantly, with strong leadership, accountability, and sustainable funding, it is an achievable one. Together, we can build a better world.